Welcome to Dateline Health. This is Fred Lippman coming to you from Nova Southeastern University, and we have a very interesting show today. We're going to talk about holistic and healing dentistry, and you're going to find out about that from Dr. Yani Dixon, who is a biological dentist. Dr. Dixon, how are you?
Very good. Thank you for having me here.
Thank you.
Very excited to share some information.
Thank you. And Meghan Mers, who is a registered dental hygienist, and Meghan has the opportunity to see a lot of people like yourselves that are watching, and she's going to tell you why you need to have a dental hygienist see you. Correct, Meghan?
Yes, correct.
Right. Okay. So, Dr. Dixon, tell us about what is a biological dentist?
Well, biological dentistry focuses primarily on offering the same comfort, aesthetics, and function to patients under a more toxin-free environment and materials. We want to minimize exposure to toxins, to galvanic corrosion and stress, and also select materials that will have less immune reactivity on our patient's immune system.
My understanding is that you became very interested because of immunosuppressive disease issues. Mm-hmm. And I'm not asking you whether it had to do with you, that's not my question. But you got interested in that, and you started to, I guess, devote your time to do exactly what you just said, mm-hmm. and that is change the elements of presenting dental medicine as we know it today in an environment which is less toxic. Is that what you're saying?
Correct.
Right.
I mean, there's a large percentage of the population that are very sensitive to multiple chemicals, and that accounts for about 33%. So based on that, and based on the studies from the International Academy of Oral Medicine, which was created in 1984, supporting a more biological, biocompatible practice of dentistry, raised the interest on me on further my educations in a more biological aspect of my practice. We see a lot of people with autoimmune conditions, chronic inflammatory diseases, and they come to the office highly educated, looking to get heavy metals out of their mouth, find materials that are less toxic, less plastic, less BPAs, and that are linked with activation of the inflammatory cascade and lymphocyte production that would trigger autoimmune condition. So it's been a blessing having these patients, because it's also a learning, a symbiotic relationship that we have with them. They are so educated, they know what they want, and I think that every time we become more capable of providing a more biological, less toxic environment for them, and also for us as occupational hazard. We've been exposed to so many chemicals just environmentally, so we try to make in the office a healthy environment where we inhale less mercury pollution or vapors that are being linked with degeneration of the central nervous system that can cause desensitizations of a lot of our immune cells, especially lymphocytes, T cells, and also provide with alternatives that will cause less side effects and risk to our patients' overall health.
So, Meghan Mers, how do you fit into this picture?
So being the hygienist, it's really great in this office because we're very chill in our office, and Dr. Yani lets me explore, lets me do whatever I want to do, and we just, our goal is to really help each patient individually. We want them all to be healthy, obviously, but so many of our patients, they come in with, periodontal disease and all sorts of problems with their mouth. But for me, it's so important to get them their gums especially back to health. So for every patient, we measure their gums. We want to see their starting point, and from there we kind of put together a treatment plan or a game plan, and we get to treat each person how they need to be treated, whether that be a deeper cleaning or a prophylaxis, which is, it's really great because, those people that come in and they need a lot more work, or, the deeper cleanings, when you're finished with everything and you bring them back in and their gums have healed, it's an amazing feeling.
Let me ask you, because, the typical viewer who's watching right now says, well, I go to see my dentist when I'm in pain, or I have a real problem, and that's when I go to the dentist. Now, that's not the way to take care of oral health, but let's be real about it, that's what a lot of people do.
Oh, for sure.
But there are the people who do see their dentist twice a year, as generally prescribed in good health habits, and they get to see their dental hygienist at least twice a year.
Yes.
Hopefully either at the same visit or sometimes attendant to that visit, correct?
Yes.
So tell me again, because you talked about prophylaxis and things of that nature, but people understand that they know now that a dental hygienist just doesn't clean your teeth.
Right.
So make it oversimplistic and tell them what you do in a prophylaxis, and tell them what you're doing. You're doing certain elements of scaling and treatment that is associated with the care that Dr. Yani gives. So explain it.
Yeah, so if a patient's coming in for a prophylaxis, we start every appointment by measuring their gums like I talked about earlier. That way we can make sure that their gums are staying stable. If they're not staying stable, then there's something we got to do to change that. So as long as they're healthy and stable, we'll continue on with the appointment. We explore to make sure there's no tartar, calculus buildup underneath their gums, and then we go on with the scaling and what needs to be done. What I love about our office is we make our own cleaning paste instead of the little individual ones that you've seen probably at most of your dental offices. We make it from scratch with all natural ingredients, baking soda, coconut oil, essential oils, and all things that are chemical free, which is really great, and it tastes good too, so that's a plus. And for patients that come in and they need the scaling and root planings, where you go under the gums and you remove any bacteria, toxins, or tartar buildup that's under the gums. Once we're done with all of that cleaning, we use a chemical-free irrigation product. It's a mouth rinse, but it's all made of essential oils as well. And we use ozone therapy to help bring oxygen into it, and that helps disinfect any leftover infectious microorganisms or stuff like that. And that we kind of squeeze in between the pockets and stuff. So that really helps clean everything out at the end. And we are really leaning towards using laser therapy instead of antibiotics for people with those pockets in their mouth, the deeper pockets when they need the scaling and root planing, just because we are walking away from any antibiotics. We don't want to put anything foreign in the body unless it's absolutely necessary. But with the laser treatment, it's a diode laser, so it's not harsh to your body. There's no chemicals going in, and we've seen really great results with that helping heal your pockets and stuff.
Well, Dr. Yani, I guess you have, Dr. Dixon, I should say, I call
I
you
go
Dr.
by
Yani, but you certainly have someone working with you that is, I guess, not only knowledgeable, but enthused by the partnership that she has with you. But in your practice, do I assume that you, as a general dentist, that you do all the other procedures, or what?
Yes, we do the wide range of different.
Periodontist, endodontist.
Well, in the office we have a periodontist.
You have a.
Yeah,
Tell me the setup of your office. Go ahead.
Well, I'm the general dentist who does all the restorative work, cosmetic work. I do some simple extractions as well with guided tissue regeneration and prepare sites for implants, but more advanced surgeries. In biological dentistry, we also focus on the detection of cavitations through 3D scanning taking a CT scan to determine bone lesions or bone necrotic lesions that could be a source of chronic inflammatory conditions to the body. After extractions, if the tissue is not very well cured, a lot of people can walk away healing, but leaving leftovers of granulation tissue, inflammatory tissue that can lead to release of inflammatory proteins into the bloodstream that can have an impact on your cardiovascular system, can have an impact and predispose you to cardiovascular events like heart attacks, strokes. So we emphasize in a thorough medical history review, determine the root cause of a lot of problems. Like we talk about periodontal gum disease, trying to find the cause, what's the medical or the systemic condition aggravating and giving us all the oral manifestations. Because unfortunately, 80% of all oral conditions will have a systemic impact in our body. Will impact also our microbiome, the change of our microflora and the type of bacteria that lives in our intestinal gut will reflect the changes also in our oral environment, because the intestinal tract starts in the mouth, and a lot of people don't make the connection of the mouth with the whole system. They take it as a separate entity, not knowing that 80% of systemic medical illness or diseases are produced in the mouth. In the mouth is when we start seeing a lot of the culprit of disease, where it starts the oxidative stress impacting this healing and how cells regenerate. So we try to do a very thorough nutritional counseling as well. We test the pH of our patient's saliva, because cells need to heal under alkaline conditions. So we try to make patients aware about the processed food, fast food, and the impact that it has, the nutritional impact it has in their body, and the healing as well, and the production of a lot of inflammatory proteins that could impact the healing rate. And we're not going to say that everybody heals 100%, so we have to look at the root cause of their problems. And through a medical history review, the medications they take, the possible allergies that they have. We try to work with cardiologists, with a lot of physicians too, because I think the biological dentistry, even when it's not an actual specialty, it's a mindset, an attitude, incorporating a less toxic environment, but a more systemic and interdisciplinary approach to try to find the root cause of our patients' conditions.
We did a large clinical study, research study here, on the question of cardiac disease, and I guess you could say periodontal disease. It was a little bit more than just periodontal, but in essence it was periodontal disease and the effect it had on the cardium.
That's one of my passions. My dad had 2 strokes, so that triggered in me to, find that connection. My dad struggled for periodontal disease his entire life, so multiple periodontitis. And when I saw him, being affected by such debilitating condition, having a stroke, triggering me to associate with the International Academy of Oral Medicine, because besides your immune system, bacteria, the acidogenic theory, we needed to look into something else. And the first thing that I did is inspecting my dad's mouth. He lived in South America, so I wasn't taking care of his dental condition. And I noticed he had a lot of mercury fillings. Mercury's fillings, and there's studies about they're being linked, inhibited a very important enzyme, COMT, catechol-O-methyltransferase, which is involved in the kidneys regulating high blood pressure. So that was for me a very interesting finding. I mean, basically because it's related with something that is so close to my heart. And another thing is knowing that what we're exposed on a regular basis, I mean, we are taught to believe that amalgam, silver fillings are alloys that are mixed, and once are in the mouth are inert. But really, science is proving otherwise, and that's becoming an occupational hazard and also an environmental pollution. I mean, just to say it, an average dentist releases about 250 micrograms of mercury into the sewage. And I know that's why the EPA now is implementing new filtration system for mercury for the water, because they know that's contaminating our soils, our water. So an average dentist produces about 12 tons of mercury. That has a major negative impact in the environment. I mean, there's so many aspects about contamination and toxins that interest me from a personal point of view. And I mean, I suffer from a lot of endocrine disruption and thyroid issues. And we notice that a lot of chemicals that we deal on a regular basis in dentistry are hormonal disruptors, can cause infertility, can cause delayed hypersensitivity, not only the immediate allergic reaction, but also the delayed reaction. That's why when we're dealing with patients that are very debilitated or sick, we recommend Clifford test, which is a test that can test for hypersensitivity to all the different materials that we use in the dental practice, so we can select the materials that are safer and patients can tolerate without an exacerbated hypersensitivity reaction.
What do you think about all of the implant issues?
Well, there's new data showing that implants will never give you an immediate rash reaction, which is the typical allergic reaction that we tend to see with nickel, for example. And nickel, it's involved with a lot of prosthetics, and we deal with nickel. It's in our stainless steel material sometimes. But titanium, what we see, some patients, fortunately it's only 4% of the population that are more prone to develop allergies to titanium, can develop a delayed hypersensitivity reaction, which is a type 4. You can use a test, it's called the Melissa test. If you're suspecting you might be allergic to titanium, you can test for that. The Melissa test is a memory lymphocyte activator test, and it shows if your lymphocyte have a reaction or had developed antibodies that will make a positive finding for allergy to titanium. But now we have also zirconia implants that are becoming more broadly used in the dental field, and especially in the biological field.
The truth is, though, that you know, the general dental community is using products that are presented to them through their educational process. Mm-hmm. Many people have been out of their educational process for 20, 30 years, and they're doing the same type of dental practice that they did 20 and 30 years ago. So that's not to say anything that's wrong with what they're doing, but you're bringing some new view to what should be, shall we say, offered to the practicing physician to perhaps alter the utilization of certain materials and to create a different environment. Is that your task?
Well, we all have to evolve. If we don't evolve with the fast pace of technology and advances in research, we're going to be practicing dinosaur dentistry. And I've been trained originally in Brazil in the early 90s. So I've seen the evolution of dentistry from, you know, even mixing the amalgam and mercury fillings with our own hands or using triturators and absorbing it through our skin, from evolving to a nanoparticles of ceramic incorporated in white filling, composite and bonding, 7th generation bonding. So yes, in the office, we're very grateful. I mean, every time there's a great product, I get it for the office. We use high-tech technology. We design our porcelain crowns. There's some studies that show that crowns outsourced to other countries were coming back contaminated with lead. That's when we decided to eliminate the use or minimize the use of metals, or even outsourcing to to labs. So we make the investment to get the CEREC machine. We scan our patients' teeth. We design in the computer our patients' anatomy and crown for their crowns, and we print it in a 3D printer. So the whole process can be done in about 2 hours, which saves patients, is convenient, and is more biocompatible as well. And the whole process is controlled by me.
Meghan, so now that you're influenced by this magnificent intellect that we have relative to and an advocate for I guess you could say, biologic dentistry, clean dentistry, I'll call it clean dentistry.
Okay.
Although I think all dental practitioners are trying desperately to have proper, antiseptic and non-sepsis environment. Mm-hmm. But in working in a venue such as this, and I hear there are multi-practices that are affiliated with your dental practice. Is that true?
No. I have only my office. It's located in East Fort Lauderdale. I just work in one single place,
and
one location.
You don't have it. So if you need an endodontist, where do you go? Where do they go? Or do you do it?
No, I have the specialists that come to my office. They work under my supervision.
All the specialists and endodontists
And periodontists,
etc. They come in to do their work.
Yes.
Okay. So now you have to work with the people that come in there. It may not always be the same person.
It usually is.
Is it? Mm-hmm. Do you have any problem dealing with what their theories are?
They're not as into the holistic approach as us, but they try to understand it and use what they can from it since they're working in our environment.
Dr. Dixon, let me ask you very quickly, because we're down to the last 4 minutes of this show. You said that you offered nutritional advice. Where does the nutritional advice come from? From yourself, or does it come from a...
Well, I'm not trying to play a nutritionist, but I want to know what the type of nutrition my patients usually have, because you're going to see that if they have a very processed, fast diet, they're going to tend to have very processed teeth. When I'm talking about nutrition, I'm trying to guide them into a more plant-based diet where they will be exposing their body to most oxidation stress.
So I want to say thank you to Meghan Merz.
Thank you for having me.
And you keep on doing what you do and listen to the boss.
Of course, every day.
And Yani Dixon, D.M.D, biological dentist. You're a tremendous advocate and you're a believer. And I always say the advocates are the blessed people on earth. So I wish you well. Keep on going. And you ought to try, I don't know what your relationship is now with Nova Southeastern University, but you really ought to. Our dental school is in the same lane that you're in. So I think you need to communicate with the leadership there. And thank you very much for being here. Where is your office?
I'm on Davie Boulevard in downtown Fort Lauderdale.
What's the address?
212 Southeast 12th Street in Fort Lauderdale, Florida, 33316.
Okay, good. So people can call you if they wish. And folks, you've heard a lot of interesting things today. You wanted to know about dental hygiene, and you want to know about dentists, just general dentistry. You got a lot more than just general dentistry today, and I hope that it opens up your mind to some of the things that Dr. Dixon said. And I wish you well. I always tell you that I want you to take good care of yourself. In this case, you got to see your dentist at least twice a year. That I can tell you. And whether you see Dr. Dixon or you see other dentists, you got to see your dentist. And if you have any questions of the dentist, ask them. They'll let you know what they know and what they don't know. How about that? I want you to use this email address and telephone number if you have any questions or you have any thoughts about other programs. Please give us a call. Remember, I always tell you, take good care of yourself. In this case, take good care of your dental structure. It's not just mechanical. It's part of, like Dr. said, part of the intestinal system. So you got to take good care of it. And remember, this show comes to you from Nova Southeastern University. My name is Fred Webb, and until next time, see you.